Dr. Samuels, I have a question here. Every dentist, keeps saying you've got to keep your gums clean by brushing, flossing, and by going regular dentist, and make sure you don't get gum disease. Because if you get gum disease, you're losing your bones, your gums get eaten away, basically, you have an infection, and you will lose your teeth. Now, while this is a very bad thing, and you talked about how losing the teeth creates havoc and obviously costs money, but here's the thing. At the very least, dentistry has advanced to a very high degree that a good dentist can replace your teeth pretty much, gorgeously. Now, with some money, and nobody wants to spend money on a dentist if he doesn't have to. But here's what I, think here. If it is true that this gum disease gets your teeth losing, and it is an infection, that yellow, ugly pus right in your mouth, right at the gateway of your mouth, and it's dripping into your bloodstream on a minute-by-minute basis, going to your kidney, going to your liver, bringing your immune system down. Apparently, a pregnant woman had premature born babies, underweight. Never mind the one lady in California who had a stillborn baby. Okay, very, very extremes. But if something so extreme can happen, wouldn't it make you fatigue? Wouldn't it make you you're more susceptible to the next flu season, which surely is going to come? We probably are in one right now. Tell me about it. Am I imagining things here, or is there some truth to this? Wouldn't be the actual gum disease more devastating than the tooth loss, which is devastating enough?
Well, over the last 5 to 7 years, we've discovered, with no uncertain terms, that the bacteria in the mouth can get into the bloodstream and can cause all kinds of systemic complications. And people don't want to talk about this, but with autopsies, they discovered people who had died of congestive heart failure or heart disease. They actually had all this type of oral bacteria directly on the heart and the heart valves. So it is a very serious matter. There's no question that gum disease can lead to a lot of systemic problems. Now, does that mean that if you have a little bleeding gums in your mouth, that you're going to die of a heart attack? No, of course not. But just like anything in life, if we know something can cause harm, we want to try to do something about it, because over the long term, if things get worse, it can certainly have an effect on you. So people, for example, who are highly susceptible to gum disease because of genetics, they are more susceptible to systemic complications because of the gum disease and the bacteria that gets into the bloodstream. Now, I would say that it's a little more involved than just picking up a toothbrush and a piece of floss. People who are highly susceptible probably need advanced types of care in a dental office, in a periodontist office, to really rid them of this gum disease, of this particular disease that has certain bacteria that causes all these systemic complications. But most people can be treated, and then with proper home care, good brushing, good flossing, we can probably fend off this disease from causing further problems in the body.
Yeah, I mean, most people, if they would have a bleeding a bleeding tooth nail, an ingrown toenail, or just anything on their hands, they would go and fix it. But apparently we do not, most of us do not fix gum disease because, I bleed a little bit. But as you said, a little bleeding might not be the end of the world, but a little bleeding for many, many years, obviously then problems can happen. So do you think that a gum disease person will have a lowered immune system, or maybe has a lowered immune system? What's your take on it, very directly?
I don't think there's any doubt that their immune system is lowered because of it. There are cases where someone who has a lower immune system has gum disease, and it might actually happen in that order. But people who have gum disease also have a lower immune system, and I do believe that the gum disease can cause the lower immune system. So yes, they are related. We have found cases of links to diabetes with gum disease, and as you mentioned, problems during pregnancy. So, I mean, there's enough information, there are enough facts out there to tell us that gum disease is a real problem. It's not just a problem of the teeth and gums. It's a problem of your overall health.
Well, I mean, it has been for a long time that dentists, the medical associations have linked gum disease to heart disease, to stroke, and it's quite amazing that most of us are still reluctant to take care of it the way it should. Here there is this silent killer going on, and then we call it a sudden heart attack when it was in the making for 25, 35 years. And,
you're right.
And not that necessarily the gum disease will have prevented it all, but it makes sense to me that you want to remove every potential which contributes to it. Well, again, I think that sheds some light on gum disease, and one of the most important things, and say yes or no to it, very clear. It doesn't matter at what stage the gum disease is, you can fix it literally overnight, meaning within a couple-hour visit or whatever it may take to fix it, but it can't get eradicated immediately, period. Yes or no?
No.
No.
No. It sometimes requires several visits. But yes, we can control all forms of gum disease. We cannot cure it. If you cut the skin, you break the skin somewhere, and you develop an infection, when that skin heals, the infection will be gone forever. The mouth is a different story, because every time you open your mouth, the bacteria that causes disease enters it again. So we cannot cure gum disease, but we can control it. With the proper care and then the proper home care, we can pretty much rid you of the disease process by controlling it.
By controlling it. Wonderful.
Mm-hmm.
And that means not just not getting worse, but bringing it to a stage where it is harmless to the body.
Exactly. Actually, cure is the wrong word, because cure means it's done with. Forget about it. Mm-hmm. We can't cure it, but our controlling of it is in fact removing all the bacteria so it's not there anymore. And then with proper brushing and flossing, it will maintain the situation. Because you're highly susceptible to gum disease, if you stop the brushing and flossing and you stop your regular visits, it will come back, which is why we cannot cure it, but it can be controlled.
Comes close enough to cure to me. Thanks a lot.
Yeah. All right.